Hey folks, it's Dr. Mike and it's Sunday, October 21st. Well, actually for me, it's October 20th. I'm actually shooting this video on Saturday morning here at Medical Fitness Pros. And what we've done here, folks, is we put together a flow chart of how to manage a medical exercise training client. I know many of you are transitioning from personal training into medical exercise training. Many of you are just getting started with medical exercise training. So this idea of all these things that need to be done from the standpoint of managing this medical exercise training client and communicating with the doctor, making sure you're looking at the right goals, which protocol, the anatomy, pathology, it's a lot of stuff. It's a lot of moving parts. It's a lot different than personal training. So if you don't mind, please forgive my chicken scratch. I know I have terrible handwriting. You probably can't read it well. We will clean this up and give you a hard copy that you'll be able to download in the next few days. That will make this a lot easier. But for right now, just please accept the spirit of how it's done, just to say, hey, this is something that can work with regard to how we all should have a general flow of managing our clients. Now, I'm here at Medical Fitness Pros. We've got our POST program going on, and POST is our program that's designed for post-stroke clients after they finish with physical therapy, chiropractic, and medical care. So I was helping out Andre Gramion, the director of our program, this morning, and it just dawned on me that we needed to put this in 30 for 30 just so you would have a better idea of all these pieces that I've talked about, kind of how they all work together. So if you don't mind with this, we have a number of different phases, and over the next several 30 for 30s, we're going to go into each one of these phases. But please, if you would, just bear with me as I kind of just give you a summary of this. The initial contact is that initial contact that you make with the client, okay? That first phone call, email, or text. Hopefully it's a phone call, and in that call, you want to get the client's condition or their diagnosis, who's making the referral, but most importantly, their MET needs. What are they coming to you for? Now, in your head, you're going to do a quick anatomy review. You're going to determine who you need to communicate with, and then you're going to schedule the client and make sure that you go over the fees and attire that they need to wear or bring with them so they're appropriate for the first session. In that initial session, actual physical initial session, there are a number of administrative things you've got to do. And we noted here administrative forms, including a demographic form, release of liability, release of information, set up payment parameters, and then also if there's any insurance coverage. And folks, let me make sure everyone understands there is nothing illegal or unethical about an insurance carrier paying for medical exercise training services as long as you clearly note your background, your credentials as a medical exercise professional, so that there's no misconception or misunderstanding that the client is getting physical therapy services. That's a very important point. Now, once you get that administrative portion of the assessment session or initial session done, then you're going to get into the assessment. Make sure you do a good history on the client. And notice I've noted pain here. Use a pain scale. And I think a lot of our MESs have a tendency of, I want to figure out what the client's pain is. Folks, pain is very subjective. Don't get focused in on their pain. Get focused in on what type of functional deficits they have, how the pain is affecting them. But this shouldn't be just about pain management. It should be about improving their level of function, because they've already gone through physical therapy, chiropractic, and medical care. And going down that rabbit hole of pain management, folks, can take you into some places that can get you into some rather challenging situations. With that assessment, you're going to establish baselines, identify functional deficits the client has. If there are any red flags that say the client is inappropriate, obviously you're going to check blood pressure, heart rate. Now, we know glucose levels here. That would be for the diabetic client, but you don't do that. The client does it, where they do the pinprick themselves, or they have a glucometer, they do that themselves. You're not the one doing that, okay? And then you select whatever medical exercise training or post-rehab protocol you're going to use for the client. After the assessment is done, then you're going to determine the functional outcome measures you'll use as a means of determining if the client is making progress. We'll talk about those later. Short-term goals and long-term goals should be established. You're going to write a summary of what you found in the assessment. You're going to develop your program, you're going to get a medical clearance, and then you're going to forward that report over to the doctor, therapist, or chiropractor that referred the client, or the medical professional that's the professional of record in managing that client. After you've done all that, you'll schedule your sessions once a week, twice a week, 3 times a week, once a month, whatever the case is, that's appropriate for the client based on what the two of you mutually agree upon. And then you're going to start your training sessions. And forgive me, we got a little bit of when we were putting this back up on the board, it got a little bit scratched there. With every training session, you're going to start out by checking blood pressure and heart rate. Even for your apparently healthy clients, check blood pressure, heart rate. There are plenty of monitors around that can do it electronically for you. And if they're diabetic, make sure you do have them do that blood glucose check, because we want to make sure that we don't put clients in any type of jeopardy with the exercise program. Obviously, you're going to do your warm-up. You need to think about the goals you have for that session, and then you're going to train the client. And train the client with whatever means you feel is effective that will help the client reaching their goals. And of course, you're going to document what you're doing with that client. This becomes important, to document what you're doing with the medical exercise training client. Now, that's what you're going to do during those training sessions, but periodically you're going to need to produce a progress report. The progress report should be a one-page document that addresses the deficits and goals that you noted during the assessment or the post-assessment, the assessment summary. Also, you're going to note the activities and exercises you're doing with the client, your recommendations with the continuation of the exercise program, or what we call your plan of training, your POT. This should be done every 30 days or whenever the client is going back for a follow-up visit with their physician, chiropractor, or physical therapist. You need to produce a progress report that gets there to the doctor or therapist or chiropractor's office before the client arrives. Okay? So now, as a brief summary of all of this, the key points, with medical exercise training management, the keys are: make sure you understand the anatomy and pathology of the client's condition. We talked about that up here. Make sure you identify any potential red flags that will be problematic with exercise, and also determine if the client is appropriate for exercise. Identify functional deficits, and then the functional outcome measures that you'll use to determine if the program is effective. Develop the medical exercise training program, and obviously the training program will change and morph as you work with the client. Remember to establish short-term and long-term goals. Your exercise programming should take the client to those short-term and long-term goals. And please, folks, document and report what you're doing. With that initial assessment, you need to write out an initial summary to say, here's what we found with the client, and then periodically write the progress reports. Again, every 30 days or whenever there's a follow-up visit. Now, that's a lot of stuff. Oh yeah, this is a lot of stuff that you now have to be careful about, that you have to think about. It is. But with medical exercise training, we also tell you through our courses at the Medical Exercise Training Institute, you should charge more for medical exercise training for both the assessment and the sessions, because it does require a greater level of professionalism as well as a greater level of professional competence to manage these clients. So we'll be back tomorrow with another 30 for 30 where we'll talk about these first two phases, give you a little bit more information, and we appreciate you just simply bearing with us with this hieroglyphics that we have here, but it kind of gets us started with the idea of client management. This is a system we go into in great detail in our MedX Pro 360 program, as well as we go into a much greater depth with the program that's starting in November, our Medical Exercise Program Director Mastermind and Residency Program. So thanks again. We'll see you tomorrow for our next 30 for 30, and please visit us over at medxpro360.com to get more information on our programs. Thanks a lot, folks. We'll see you tomorrow.